Hello, everyone. Thank you for joining me today for our webinar on back pain. Can everyone hear me? Can you just maybe type in the chat, just say yes. Um, I've done this before, but I haven't done a webinar like this in a while, and I just want to make sure everybody can hear me. It's Dr. Cary Yurkiw here, and I'm just going to walk you through um, how I treat back pain. I've been a chiropractor for 26 years, and I've helped a lot of people with back pain. Can you see the video screen as well? That's the other thing I wanted to check on. The slides, can you see the slides? The one that says back pain right now? Okay, good. So I want to welcome you to today's webinar. And first, I wanted to know how you found out about us. Did you find out about us through Facebook, or maybe it was through Eventbrite? Maybe type in the chat window how you found out about this webinar so I'll know. If you have any specific questions today, feel free to put that in the chat window. I'll check the chat window as we progress through the webinar. And then you can always email me as well. You received an email today from drcaryyurkiw@gmail.com. You can respond to that email, ask any questions, and I'd be happy to answer those for you. I just started a practice in Kelowna. Our family moved here a couple years ago. I was down in Penticton for 10 years. We lived in Summerland, and before that, we're from Winnipeg, and I was practicing there for almost 15 years. So, been a chiropractor for a while. I saw a chiropractor as a teenager. So initially, I had a lot of knee pain and hip pain. I went to a chiropractor in our area, and he really helped me out. And I thought, well, if this chiropractor could help me, it would be great to be able to help others just the way he helped me. So that's when I started thinking about chiropractic. I had an aunt and an uncle that were a chiropractor as well. And they told us stories about how they help people in their clinic and all the great, you know, the patients that came in and the conditions they treated. And I thought, well, that with my personal experience really motivated me to become a chiropractor. In high school, I decided that's what I wanted to do. I went to the University of Winnipeg, and then after that went to CMCC, which is the Canadian Memorial Chiropractic College in Toronto. And then I've been practicing for 26 years, as I was telling you, and this is my 12th year in the Okanagan. So back pain, how does it start? Probably a lot of you on this webinar have back pain. So how did it start for you? And you can type this in the chat window so I can see. But was it an injury? Sometimes there's an injury that happens a long time ago. Maybe you were a teenager or a car accident in your 20s or 30s. So it can be an injury or an accident. Sometimes it's repetitive strain. I have a lot of people that come in that are working and they do a physical job and they're repetitively straining, twisting a certain way. Maybe they're sitting a certain way and they have poor posture at work, slouching or leaning off to one side or looking one way at their desk. And then that causes strain on one area and causes the spine to get overused in one way. And sometimes it's just spontaneous. So I've seen people that have come in with no cause at all. So they just said, you know, my back just started hurting. Usually it's people in their 20s and 30s when they first start to have back pain. So sometimes it's a spontaneous start to their back pain. Thank you for typing in your messages here. So I'll just put in, when did your back pain start? We just had a few people join us, so thank you for joining us. So when did your back pain start? The spine, it consists of 24 bones called vertebrae. There's nerves that come out of the spine, one on the right side of the spine and one on the left side. So there's sets of nerves between each vertebrae, and there's a little hole between each bone called the foramen. That hole allows the nerve to exit and then to travel to other parts of the body. And a good example, relevant example for today's webinar is the sciatic nerve. The sciatic nerve comes out of the low back and it travels down your legs all the way to the tips of your toes. So sometimes when the low back's out of place, it actually causes the sciatic nerve to be affected, and then you can get a referral down your leg. It's very common. The sciatic nerve is actually one of the biggest nerves in the body, so it's commonly affected when a person does have back pain. There's muscles that are around the spine. They protect the bones, and then they allow you to move and twist and bend and give you the power to do the things you want to do. But when the spine's out of alignment, it actually causes those muscles to tighten and there's an imbalance. So one side of a spine, the muscles are loose and the others are tight, and that's to accommodate for the position of the bones and your posture. That weakens the muscles and it causes spasms of the muscles, which can cause symptoms for patients. So when the spine's out of place, it doesn't work properly. It affects the areas around the spine. Often there's swelling or inflammation that develops. It feels really tender or sensitive to the touch. And then when the muscles start to get involved, it gets tight and painful to move. The nerve control comes from the brain down the spinal cord and then exits between the vertebrae and go to all the parts of the body. So here in this picture, it shows the sciatic nerve, and the sciatic nerve comes out of the last 5 segments in the body. Actually, the last 2, L4 and L5, and the first 3 sacral segments, the tailbone area. And so those 5 nerve roots make up the sciatic nerve. It's a really thick and powerful nerve, and it sends signals from the brain that are coming down the spinal cord and then exiting, going down pretty much all parts of the leg. 3/4 of the leg is controlled by this sciatic nerve, and it controls the muscle strength, the sensation coming back to the brain. So it's a two-way street between the nerve flow from the brain to the body and then from the body up to the brain. When a nerve is affected, when it's pinched, it can be very painful. So not only can it be painful in the area where the nerve's pinched, but it can be painful going all the way down the leg. And it can cause symptoms like numbness and tingling. It can cause cramping. It can cause hot and cold sensations. These are very common. So if you have back pain, I'll just type in the chat window, what symptoms do you have? So I know more about the people who are in this webinar today, so I can tailor the webinar a little bit towards you. So it can be very painful, and there's only so much room between each vertebrae, and if the vertebrae shifts, it narrows the canal, the foramen, between the bones, and then the nerve flow can't get through as well as it could if you had the proper alignment and proper function of your spine. So what is the process in the clinic? And sometimes people have not been to a chiropractor before. That's a good question for you guys. Have you been to a chiropractor before? If you haven't been to a chiropractor before, then the first step is we do a history. So we want to know more about your current condition, but we want to know going back when it first started, what caused it, and if you've had any other health issues that could be related to that. Sometimes people have osteoporosis, which is a weakening of the bone, and that can affect the spine. Sometimes people have osteoarthritis, which is a different condition, and it causes the bones and the joints to start to wear out or degenerate. So it's important for us to get a thorough history, a complete history. Sometimes I know patients will come in and they'll just specifically talk about that one episode, but really for us to understand the problem properly, it's good to have a full and complete history. And then we do an examination. So the examination allows us to fully assess the spine to determine what the problem is. This may involve checking your posture, your alignment, your range of motion, and then doing tests like orthopedic tests and neurological tests. All of these examination procedures are clues as to what the cause of your problem is. Once we find the cause of the problem, then we make a diagnosis. So we want to let you know what we found out, what the diagnosis is, and then how we're going to go about treating your back to get it in better shape. So initially, just going to move my chat window here. Initially, we recommend treatment and a treatment plan. We'll follow up with the treatments to make sure that the person starts to feel better. And then we're going to give you some things to do at home to maintain the changes we're making in the clinic. So how do we assess the back? Range of motion is important. So when you're bending, twisting, we want to go through the ranges of motion and look for any limitations and where the pain is. We want to check your posture. The posture tells us more about your alignment and the condition of your spine. Sometimes we'll see a scoliosis or a twisting of the spine, and the most common one is an S shape that can go all the way down to the low back. But sometimes we see a C-shaped curve, which is another type of scoliosis that can affect the middle to lower part of your spine. So the question is, does anybody have a scoliosis on this webinar? And then posture, oh, we talked about that, sorry. Palpation, we check for spinal segments that are out of alignment. So we'll get the patient to lie on the table, we'll palpate their spine, see if any individual segments are out of place. Sometimes there can be 2 or 3 or 4 together that are out of alignment. We check your hips to make sure that the hips are level, and if they're shifted, we can see a short leg or a rotation in the pelvic area. These are all clues, again, as to what's causing the problem. And personally, I like to focus on the primary cause. So let's say there's one vertebrae out of place more than the others. I like to start the treatment on the L5 vertebrae, see how the body responds. Sometimes L4 will come with it, and the sacrum will start to realign with it. So I like to be very gentle, very specific with my adjustments, and then monitor and see how the body's changing with the care that I'm giving. If I need to change course, if I need to start adjusting the 4th lumbar as well as the 5th, then I will do that. But it's just one step at a time to get the person back in the right shape. So how do we treat back pain? Well, we do adjustments. And for adjustments, the adjustments in our clinic are done hands-on. So we use gentle manipulation or hands-on treatment, but we also use instruments to adjust the spine. I have 2 types of instruments. I have a activator and I have an integrator. They do different things, but we can tap the bones back into place or even use a table. Sometimes we'll adjust the table will pop up and down, and that'll help us to make specific adjustments to the spine. Sometimes when people haven't been to a chiropractor, they're scared. They're scared it's going to hurt or something worse will happen to them. I like to reassure patients that I've done this for a long time and the adjustment actually feels quite good. Sometimes touching the area when we go to do the adjustment is painful, but when we do the adjustment, there's often a release and the patient feels a lot better after that adjustment. We give patients advice. So we advise on proper posture, on stretches, lifestyle changes that support you in the work you do and at home. And more recently with COVID and what's going on in the last few months, I've started to use telehealth more for that. So as the patient progresses, we have special software where we can actually log in like this meeting one-on-one with a patient, and we can see your workplace. So I've done some assessments of the patient's workplace to see how it's set up. I've seen if they work in a certain piece of equipment, how they work in that equipment. So basically, I like telehealth for follow-ups because it does allow us to see the environment the person works in. We can give stretches and exercises for them to do, and then follow up using telehealth with that. So I'm really enjoying using the technology to help people out. And then the follow-ups, we get people back initially frequently. So when they first get their treatment, we'll follow up in a day or two, do another adjustment, and that'll start to relieve the pressure, the pain that they're having. And then as the pain starts to relieve, we'll see them less often, get the range of motion back, the function, get the muscles relaxing, and then give them things to do to support that. If you have any questions, you can put them in the chat window right now, and we are taking new patients. So if you're living in the Kelowna area, we are taking new patients, as I just started the clinic a short while ago here in Kelowna. You can call our office to book an appointment. You can always send me an email as well if you're interested. I'll send you a follow-up email to this webinar because I'd like to know how you thought the webinar went, because I want to improve on this process. But our phone number is at 250-486-0062. And then we're located at Landmark 4. Landmark 4 is on Dixon Avenue. It's the tall glass buildings in Kelowna where the white bridge goes across Harvey Avenue. And there's my phone number and my email address if you want to contact me. Before we close, are there any questions that you have about back pain or your specific condition that I can answer right now? If you do have a question, just type it into the chat window on the bottom, and I'll answer that question for you. If not, I understand. Sometimes I don't like to ask questions when I'm on a webinar or in a seminar. You can always send me a message via email tomorrow when we follow up with you. Well, there's one question here, and the person says, I'm always interested in back stretches for sitting at a desk all day. Yes, we do have back stretches that we give our patients, and if you want to contact me via email, I'd be happy to share some of those just general stretches with you. If it's a specific condition that you have and you might need specific stretches for that, it would be good to ask your healthcare provider or come into the clinic. I'd be happy to assess you and then give you specific stretches for your desk or your posture. Are there any other questions that anyone has before we close? I was concerned we were going to run out of time today, but it looks we are a little ahead of schedule. So it's good that we're a little ahead of time, so we can take some questions here. You're welcome for answering that question. All right, well, thank you very much. I'm planning on having another webinar coming up in a week or two. So just follow us on Facebook, and we'll have a webinar coming up on neck pain. We will do ones on things like whiplash down the road. Maybe we can do a stretching webinar as well. That would be really good to give you guys some advice on stretching and posture. So I'm open to your ideas. I would like to follow up with you guys doing future webinars here, and feel free to contact the office if you have any specific questions. Thanks for joining me, and have a great weekend.